Hello, this is Dr. V. This is a short video just to review how to write a chief complaint and an HPI for your SOAP note for the iHuman assignment. So what is a chief complaint? A chief complaint is a concise statement describing the primary symptoms, the problem, or the reason why the child is there at your clinic today. So for instance, you can write complaint of cough, or you can say complaining of fever times a few days. So really short and simple descriptive terms for the chief complaint. Before we talked about how to write an HPI, let's review the difference between subjective and objective findings. Remember, the subjective is what the patient or parent tells you. The objective findings are your observations, what you see, what you feel, what you hear, and touch. And vital signs or lab results are objective findings. Oftentimes, I see students writing objective findings in their HPI, and that is not acceptable. What is an HPI? The history of present illness is a symptom analysis of your note. This is where you write and document what is going on with that patient. You want to integrate the onset, the location, the duration, the characteristic of the symptoms, any associating symptoms that's happening right now. What are the relieving factors? What's the timing? When does the symptom occur? Is it intermittent? Is it chronic? Any treatments tried? And what is the severity? You also want to incorporate any pertinent history that can potentially contribute to today's complaint. In the next several slides, I will provide some examples of an HPI. What is the difference between a novice, a competent, and a proficient? Before I show you those examples, I want students to know that this format is not how you write an HPI. Do not write your HPI in this bullet point manner. You must write a clear and succinct paragraph integrating all the critical component of an HPI. This is an example of a novice HPI. The student wrote, JC is a 7-year-old, coughing, not feeling well, mom wants medicine, eating, drinking, small amount. Child looks tired, respiratory rate 24. First of all, the student included PE or objective findings in their HPI. If you notice on the rubric, we do not include objective findings or physical exam findings in our HPI. If you recall, an HPI is solely a subjective finding, what the parent or patient tells you. Second, this HPI is lacking a lot of basic history, such as the onset, duration, characteristics, associating symptoms. Remember, integrate the old cards or locates into your paragraph, and any pertinent and negative associated symptoms. Include the risk factors. The HPI should not be written in a bullet point. I do not want to see bullet points. Remember 2 slides before I talked about what we should not be seeing in an HPI. This is an example of a competent HPI. Take a moment to read this HPI, pause the video, and then decide what are the missing components of this HPI. If you stated missing duration of symptoms, you are correct. We are also missing the information if the child is febrile, which is important. We're also missing information if anyone else is sick at home. And we are missing any significant health history that might contribute to the current health issues. Remember, we need to include the pertinent negative and positives that can potentially impact this child's complaint today. In this slide, this is an example of a proficient HPI. I want you to pause the video and read through this HPI. You will notice that this particular HPI has covered the locates or old cards mnemonic, as well as included the pertinent positive and negative that potentially can impact this child's complaint today. This is Dr. V, providing you with a quick review of a chief complaint and how to write the history of present illness. Should you have further questions, please reach out to your professor. Thank you.